Tātou kai kōrero e whai ake nei. Ako tēnei kai kōrero he tuahine kia hau. Anō reira, Fay Selby-Law, Hāpai Te Hauora. Presentation title, E kore au e ngaro. He kākano I ruia mai I Rangiātea. I will not be lost. I am a seed, descendant from Rangiātea. Hailing from Ngāti Pro, te whānau a rua taupare. Ngāti raukawa ki te tonga. Ngāti huia, nā te pare wahawaha. And Ngāti Pare Raukawa, General Manager, National SUDI Prevention Coordination Service, Hāpai Te Hauora Māori Public Health. Fay has managed the SUDI Prevention Coordination Service since its inception in 2017. As Māori are overburdened by the effects of SUDI, the team centralises its work using the Te Ao Māori lens. My whānau and I have benefited from the support of this team, and I've been able to contribute to this kaupapa, having lost in 2005 our number 6 daughter at 6 months. Without the support of Fay and her team, it would have been a very, very hard road to hoe. Nō reira, Fay began her career in the neonatal unit and occasionally in postnatal wards, which gave her an insight into maternal and child health, including the many factors that lead to increased risk of SUDI amongst Māori. During the 1990s, Fay worked beside teenagers who were pregnant and had their first involvement in cot death, SIDS, SUDI. A study on the impact of vaccinations on babies' temperatures. In the new century, Fay's main focus has been on smoking cessation, but she has been involved in a range of studies and research focused on improving Māori health. I, again, am a proud product of Fay's relentlessness on us her whānau, being 5 years smoke-free today. Nō reira, without further ado, e te iwi, Fay Selby-Law.
Tēnā tātou, tēnā koutou. Well, it's strange times to be doing a video to speak in a conference, but COVID has changed many of the ways that we do things. So welcome everybody, and thank you for having me as a part of your conference. My name's Fay Selby-Law, and you can see up on the screen my pepeha. I'm lucky to have quite a mixed range of blood from my dad. I think I get some of my vivacious French and Italian blood, and you can see from my mum's side, I whakapapa to Ngāti Porou and Ngāti Raukawa ki te tonga. My principal marae is a small marae, and you can see the photo up there of me with 2 of my mokopuna, Ngā Tokowaru, on the banks of the Hokiwa stream, which leads out to, from Levin out to the sea. I also have some Scottish whakapapa, so if there's any McLeans out there, you could well be a part of who I am as well. Okay, I want to talk to you a little bit today about my experiences from nursing, but also I'm going to start with the story of my birth. My mum, who's the Māori side of my family, was also a nurse who trained at Palmerston North Hospital in 1938. I'm the youngest of 7 children, so I have 3 older brothers and 3 older sisters. And so having birth was obviously a reasonably normal experience, I suppose you could say, for my mum. And in those days, dads didn't attend. Their job was to drive their wife up to the hospital and drop her off. The night of my birth, my dad happened to be out drinking with our family doctor, and he came home a little bit worse for wear, you could say. Mum, who was highly organised, had everybody in bed and apparently was packed and ready to go up to the hospital, and suggested to him that he probably would be needed at some point during the night to drive her to the hospital. His reply was doctors only work between 9 and 5, and so she would have to wait till the morning, and he promptly went to sleep. The story goes that Mum then prepared herself to drive to the hospital. We lived almost at the top of a hill, and where there's very small streets, skinny roads, and she drove herself between contractions to the hospital. It must have been quite a journey for her. On her arrival, you can imagine the shocked faces of the nurses and midwives when they saw her, and she advised them that she didn't want the doctor because she believed that he would be worse for wear, having been drinking with my father, and that she was quite capable of delivering this baby with the nurses. In those days, that was unheard of. And so, of course, they wouldn't take responsibility for that, and they rang the doctor, and he arrived and I was delivered. The next day at visiting time, she used to love telling us how people came in to visit, and there she was, sitting up in bed as they did in those days, and people came in and said, "Did you hear? Some woman last night drove herself to hospital to have a baby." And the poor other woman would be, kind of trying to show that, yep, there she was lying in the bed. So even today, at my much more mature age, when I return to my hometown or talk to people who know of the story, they love to remind me about it and how funny they thought my father was. My mother had great trust in the medical system, particularly nurses. In fact, she believed that we ran like this: God, doctors, nurses, and then the rest. And I guess in many ways she instilled that in me. Nursing was a real saviour for her. With 7 children, I think money probably was quite tight for periods of time in my parents' life, and Mum used to go with the local undertaker and lay out bodies and get paid, I think she said 5 shillings, which seems a terribly small amount, but I guess at the time was quite a reasonable amount of money. She nursed throughout my childhood. She was the plunket nurse in a number of towns that we lived in, and she loved it. Babies were important to us, and that led me later to join the nursing profession and to spend most of my nursing life in a neonatal unit. Mum was the second Māori woman in Aotearoa to train as a plunket nurse, and she travelled to Dunedin to do that under Sir Truby King. She was a great advocate of his and spoke about him often and the many learnings that she had. So she was taken from being a Māori woman with a very rich history into being a very clinical Western model nurse. And so that brings me to my time of nursing. Now that photograph up there is a photo of Mum and I think maybe it was my first day at school, or perhaps we were going to church, I'm not sure, but we certainly were dressed up for the occasion. When I went nursing, which interestingly was some 40 years later, but still at the same hospital as Mum, things had changed. Mum had been used to, as a trainee nurse, giving out cups of tea and then collecting the tea leaves and throwing them out and sweeping them up. She talked to me about the importance of a sharp needle to give an injection, which just seemed bizarre to me. But of course, they used to actually sharpen the needles and reuse them. She was very pedantic about cleanliness. Godliness went next to cleanliness, and the importance of washing your hands. And she was really clear about, while she was terribly proud of her nurse's badge, you didn't wear it when you worked in the children's ward or in maternity because you might harm a child from that. So she had some real safety views about how things worked. When I went nursing, things had changed a lot. It was much more mechanical. In fact, I thought we were pretty flash. We worked shorter hours, we worked shorter spells of time. We didn't work for the long, I think we did 10-day stretches still, but we certainly didn't do the long periods that she had done during the Second World War. Medicines had changed. My mum remembers when immunisation came in. She was a big believer in immunisation because she nursed many children who died in the children's ward from things like tetanus, and she believed that what we were doing was right in the immunisation space. And so she went on to encourage me to ensure that I immunised my children. When I went nursing 40 years later, and I learnt the many different things that had happened in nursing, I chose to become a neonatal nurse, and I spent nearly 20 years there. It was a really lucky time. I learnt lots. I learnt about breastfeeding, how to care for sick and small infants, and I went on to have 4 children of my own. Not much in comparison to my mum, of course. I was lucky that during that period, it was a period of Māori and iwi development. And at that time, my mum once again went out and advocated for Māori health services, and we developed a service called Whānaungātanga at Te Rūnanga. It was an exciting time. It was almost like I was working a second time in my mum's dream. I'd worked at Palmerston North Hospital like she had, and now I was working with Te Rūnanga. The initial work I did was in the whānau space, not the whānau of today, but much more of a district nursing, public health nursing, plunket nursing type of role, where we did almost anything and everything as long as our whānau was taken care of. And I think that was a really good time for nurses and for the development of nursing. Iwi health services have continued to develop over that time, and it's been a really amazing period, I think, over the last 20 to 25 years as nurse practitioners and independent midwives have come in, and something that Mum was always really proud of, that nursing had moved from the vocation of her day through to being the highly professional place that it is to work now. And so after all those years of working, I was able to move across and into this next role, which was stop smoking. For me, that was just a culmination of the experiences that I'd had in neonates, where many of our babies were born to mums or both parents who were smokers. And the photo I've got up right now, that's my mum. I think it's taken during the Second World War at Palmerston North Hospital, and the old style. She loved her cape and she loved her cap. They were really important, something that we don't see much anymore. The last 17 years I've worked in stop smoking, and that's been an amazing experience, being able to put together both the clinical side of my experience as a nurse, but also the art of talking to people, of listening, of hearing these stories. Stop smoking is a special role. It's a time for change for whānau, and I think that's a huge undertaking for anyone. And then 3 years ago nearly, I got the role with the SUDI Prevention Coordination Service, and I'm sitting here at Hāpai Te Hauora and thinking how lucky I am to have brought all these things together. This role is about really what can we do. So many of our deaths are preventable, and while midwives and doctors have a huge role, I believe all nurses do. It's important to understand that there are these deaths, for many of these deaths, they're preventable, and your place in that is important. Delivering messages is huge, and it's a lot more about listening than it is about telling. So if we can get beside whānau and share their life journey and share their plans and goals and aspirations, then I think we'll get there a lot quicker, and nurses are really well placed for that. We have wānanga wahakura around the country now, and if you don't know what those are, they're a time and a place to make a wahakura, an in-bed safe device made of harakeke or flax, and that's a place that baby can sleep with mum and dad and still be safe. The sides of the wahakura remind mum and dad not to encroach on baby's space, and it gives them some clear air to breathe. Wānanga wahakura also occur in Te Wharepora. Te Wharepora, there's only one currently in Aotearoa, in Flaxmere in the Hawke's Bay, and this is a place where whānau can go and learn how to weave. Eventually they can weave a wahakura if they become skilled enough to do that, because it takes a little bit of work. And it's a chance to talk to other mums, other whānau members, and to learn. It's a really great informal antenatal class. In fact, it's probably an informal health class. Hine Te Iwa, the guardian of that space, was really about childbirth, childcare, anything to do with women, and she was amazing with karakia. She provided that safety, something that's really important. Okay. I really like, that's me in my nursing uniform. You can see that I don't have my cape on, but I like mum, loved my cape, and was quite happy to wear a cap as well. The national message that's really important to us in the SUDI space is PEPE, and it's an easy memory guide for health professionals. So make sure that baby has their own bed. Obviously, I'm advocating for a wahakura. Eliminate smoking, and I've spoken about my role in that and my belief in the importance of doing that. Position baby on their back. So those of you who are older like me will remember the days when we had large numbers of cot death that then became SIDS and is now SUDI. Positioning baby on their backs to sleep made a huge difference, and there's a lot of research background to that. So I think that's another good message that you can encourage and you can use. And then lastly, encourage breastfeeding, immunisation, gentle handling, safe carers. We know that mums and dads sometimes need time out. They sometimes want to do things that aren't necessarily as safe for children, and so we encourage them to say, I need my time out, but always have the safest of carers. Smoking and bed sharing are the two biggest risk factors, and if you can do something about that, that's fantastic. A 32-fold increased risk is just too big. Okay, so in SUDI prevention, what we're talking about really is the opportunity to partner with whānau and help them make the change. But it's important that we don't carry any of our biases, that we don't make it more difficult, that in fact we enhance whānau. It's great to hear what their goals are, clearly in health we know what ours are, that's not difficult. But what does mum want? What does dad want? What does the whānau want? And build a plan and look at what changes can be made during that time. So that last photograph, that's me with my daughter and my mokopuna, obviously going off to see some rugby and support that. And it's really for me about continuing these generations of help and support to our whānau. So I hope that you as nurses continue to grow and learn, that you're happy to share our messages and that you're happy to be available for whānau as they need. Kia ora.
Nō reira, tēnā koe, kai te tuahine, Fay. E kore e mutu ngā mihi ki a koe mo tēnei kaupapa ngiha nui me ki kia tāua o tira tātou, o roto i te reo ao Māori, o tira huri no Aotearoa. Nō reira, e kore e mutu ngā mihi, e kore e mutu ngā mihi. I just sort of mentioned too that in your introduction that our whānau had benefited from your team and sharing in the loss that we had with our mokopuna, with our daughter. And then being a proud product also of yours, 5 years smoke-free. Anō reira, e mihi ana mai te ngākau i ti rawa kia koe. Me te mihi hoki ka whai wā koe, kōrero wānangatanga tēnei kaupapa ngiha nui mo tō tātou Conference 2020. E ki ana mo te hapori. So I'm just looking at the chat Q&A. There isn't any questions have come up yet. So whānau, if you've got any questions, please send them through. O tira, any parting kōrero e te tuahine?
Tēnā koe Cleland, he pai ki te kia koe. Only that I think nurses have a huge role in the SUDI space, in the SUDI prevention space, and just a real encouragement to the nurses out there that their clinical expertise is huge, but that engagement with whānau is definitely what we'd encourage the most.
Kia ora, and I know I'm supposed to be joining you on those weekly or fortnightly Zooms. Sorry I haven't been able to be available in the last year, building up to this year anyway. Engari, kua nui mo tēnei po, mo tēnei rā, e mihi nui mai te ngākau i te rawa kia koe. I just wanted to quickly say too, it looks like we could have another All Black in the whānau soon, and you were wearing his colours in that picture.
Ooh, hope so.
Nō reira, tēnā koe. Oh, sorry, there is one question that's come in. Kindly share where Pacific SUDI cases are reported through. So do we have a connection with our Pacific Island whānau?
Aye. So last year we were really delighted to sign a memorandum of understanding with Moana Research. Moana Research is a Pacific Island based research in Māngere in Auckland, and previously had done a lot of work in SUDI prevention. So the Pacific Island numbers are not good. So Māori SUDI numbers are the worst, and next is Pacific Island. And we think that can be attributed to a number of things, obviously. Smoking rates for Pacific Island whānau are similar to Māori.
Okay.
And so that high risk factor of bed sharing and smoking. So Pacifica whānau are very similar to us. And so, yeah, their SUDI rates are very high. They're reported exactly the same as all SUDI is reported, which goes through to the coroner. And unfortunately, I can't actually tell you the rates because, and you'll know this, Keelan, from your experience, it takes over 2 years for the coroner to confirm a SUDI.
Yep. And
so all we get is the provisional data. But what I can say is that our current SUDI rate is not good. It is definitely not declining. And that Māori and Pacifica are the highest of all the populations.
Tēnā koe mo tērā whakautu. Nō reira whae seta, I hope that answers your question. Nō reira, kai te tuahine, ke pai te toinga o tō rangi, e mihi kauatu ana anō mai te ngā kauiti rawa, e whai wāhi koe te kōrero ki a tātou. Tēnā koe, ke pai tō rangi.